Hello, Kidney Care Center family. We're celebrating our 20th anniversary this year, an incredible journey that we have shared together. The milestone wouldn't be possible without you, to our talented and compassionate staff. Thank you for your tireless efforts and dedication to excellence. To our healthcare providers, your expertise and commitment to delivering the high standard of care has made KCC a trusted name in kidney health. Together, we built a legacy of care, compassion, and excellence. Here is to 20 years of making a difference and to the countless lives we will continue to touch in the years ahead. Thank you for being a vital part of Kidney Care Center family. Um, 20 years ago, just before KCC was established, it was during my fellowship as I started my journey of my fellowship career in nephrology. I quickly realized that there was a huge gap out there in caring for patients with kidney diseases. These are a unique set of patients that need a different level of care with different kind of attention and expertise. And initially, I tried looking for a job, and after several job interviews, I realized that none of the practices out there offered the kind of my interest in the way this patient should be cared for. And that's when I started, I needed to do something different by setting up KCC. Now, this was about 20 years ago, and the driver, the passion, and for that mission was to provide compassionate, high-level, patient-centered care to patients with chronic kidney disease, where this patient can be listened to and they can be carried along by their providers in the way they're being cared for. Being a patient, anybody can be in that situation. You want to be cared for the way that provider will also care for himself. And that was how we began the journey. We started recruiting young, talented physician nephrologists, and they bought into this major mission where these patients are the center of our care. And beyond caring for this patient, the other part was also to care for them in a very comfortable environment with good ambience, not just any physician practice that patient would just go into without being catered for the ambience and the comfort of those patients. And we treated each patient as part of our family, just the way each and every team member of KCC. The mission, our second pivotal mission, is that we're family together in this journey, caring for this patient. Know that in the past 20 years, there have not been challenges, there have been huge challenges, but guess what? As we continue to get to these challenges, the people that actually help to resolve these challenges are two sets of people. Our team members, because of their focus, their dedication to what they do on a day-to-day basis, and our patients that would also even give us ideas on what we need to do, what we needed to do better in these preceding 2 decades. And going forward, KCC will stay to that mission of being patient-centric. The patients are the center of our world. That's why we come to work every day. That's what gives us fulfillment. That's what gives us happiness, and that's what gives us joy. And you see a patient from the earliest stage of their kidney disease, they progress to developing end-stage renal failure, but then we built an integrated care model where our physicians will care for this patient from the earliest stage of their kidney disease spectrum to when they got on dialysis. Most of these patients will end up being in some of our dialysis care clinic. So we build this continuum of care, and what we see as well is that building this kind of continuum of care allows the patient to maintain that physician relationship, and the physician also maintain that patient care relationship, and to the point that this patient now get transplanted to get back to their usual life and continue with their daily chores. Even on with dialysis, we are heavily focused on home therapy. Home therapy as a modality of dialysis frees up the patient time to enable them to continue to lead their lives despite being on dialysis. And as we always tell our patient, developing kidney disease or later developing end-stage renal failure, it's a burden, but that should not stop your life. We talk to our patient, we educate our patient, we counsel our patient. So 20 years after, my main motivation to setting up kidney care center is being met. There's still a lot of work to do into the future, but the fact that we now have a sustainable organization to continue to drive into the patient into the future gives me a lot of happiness, fulfillment, and contentment. But this is all possible because of our excellent providers and the supporting care team partners that we have. They all wake up every day, roll their sleeves, come to work to deliver excellent, amazing care to our patient in a respectable manner and in a very good environment.